Hello, I'm Dr. Flynn. Welcome back if you're returning, and if this is the first time to your site, we welcome you as well. This is our site, Acupuncture and Oriental Medicine. Today I'm going to talk about muscle response testing, and then I'm going to do some demonstrations for you. Muscle response testing is a way to test the body's reaction to things, and it is actually a neurological response. Your nervous system is a fabulous radar, and it senses 75 octaves. The eye only sees one octave, so your nervous system can pretty much sense anything in the universe. Now, your nervous system will sense things as a frequency or a resonance. And everything in the universe has frequency, as we know in modern days with physics, quantum physics. So what we're going to do is we're going to start out testing the strength in an arm. You can use any muscle, but I generally start with an arm and see that it's strong. And then we'll check polarity to see if we can get a weak and a strong response and make sure that the energy is going the proper direction, because without that, we can't get a good test. Now, when the nervous system senses a frequency or a resonance that comes into your field that it doesn't like, or it feels is contra-survival to your organism, it will immediately try to protect you by throwing up a block in one or a combination of the energy meridians of Chinese medicine. When it throws up the block, it interrupts the flow of energy for a moment. Therefore, a previously strong muscle will go weak. So when I'm doing muscle response testing, I will touch you with a homeopathic dilution of a substance, a vial, or people can bring in their vitamins and minerals and their hormones and their medications and just about anything that they want to bring in, and we can test for it and see what their nervous system says about that. We are going to go ahead and demonstrate muscle response testing right now. And we have a subject, Shelby, is volunteered to let us work on her. She needs a treatment anyway, so we're just going to go ahead and do some muscle response testing. And at any time that you want to contact us to get some more information, you go to our contact page and just drop me an email. And I'll be glad to write you back and answer any questions that you might have. Alrighty, so let's go ahead and get started with the fun stuff, and I'm going to show you some muscle response testing. Okay, so we're back. We're going to do some demonstrations of muscle response testing right now to see if there's any substances that weaken Shelby. Okay, hi Shelby.
Hi.
Hiya. I have, there's a whole bunch of homeopathic vials. There are probably over 800 of them, and they're just glass vials that have homeopathic dilutions of various things in them, and they all have frequency that represents substances. And I will just touch Shelby's hand with them and test her arm. So the first thing that we have to do is we have to see, can we get a test together? So what we do is, may I have your arm? I'm going to push towards her feet, and she's going to resist me. Now, I'm not arm wrestling. I'm just seeing when the arm locks out to see what her strength is. I can muscle response test little kids or weightlifters. It doesn't matter, okay? So, now what I'm going to do is I'm going to push towards your feet. You resist me, okay? Ready, hold. Okay, see, it was strong. I just gave it a little push, and it locked right out. Now I have to check polarity, like on a magnet, positive and negative poles. Okay, Shelby, will you put this hand flat on top of your head? That's a south pole and a north pole, which attract and are strong. So when I have her hold, she should be strong. Ready, hold? And she is. Now, turn your hand upside down on your head. Now she has two north poles. This is a north pole, back of your hand on a north pole. Now, two north poles on a magnet, or two south poles, will repel each other, and they should be weak. So you hold. Ready, hold. Okay, see, the arm went weak. Now, let's check if it'll go back strong again. Turn your hand over. Ready, hold. Okay, so now we have arrived at two things. You can put your hand down here, hon. First of all, Shelby and I, we experience that we can arrive at a weak and a strong response, so we can test. but it also told me that the energy is going in the proper direction in the body so we can get the right answer. If it wasn't going in the right direction, a yes would be a no and a no would be a yes. We'd really get some skewed results there. So anyway, ready, hold? Okay, so she's strong. So what I'm going to do is I'm going to bring the resonance into Shelby's field, and I'm going to test her to see, well, what does your nervous system say about this, okay? So, ready, hold. That was strong. That was the category of food. Ready, hold. That's the category of environmentals. That weakened her. So we know we're going to have to dive into that a little bit. Ready, hold. And that was the category of chemicals. So environmentals came up. Now I'm going to do a quick nutritional assessment to see if there's any deficiencies. Ready, hold. I don't get any hormone deficiencies. Good. And ready, hold. Minerals and trace minerals are good. Ready, hold. Vitamins are good. Ready, hold. Oh, digestive enzymes came up. Are you taking enzymes?
No, am
I don't know, are you?
I think I have some from a while ago.
Okay, well, it's showing that you should get some enzymes.
Okay.
So let's test to see if you're, the test showed that she was weak in digestive enzymes. So now we're going to try to see, well, do you need to just take some enzymes, or are you actually intolerant to or sensitive to your own digestive enzymes? So that's the first thing we're going to check here. Ready, hold. Well, lipase was strong. That is your fat metabolism. Ready, hold. That's trypsin, chymotrypsin, and pepsin, which is for mostly proteases, protein digestion. And ready, hold. Amylase and ptyalin, which are good for carbohydrate digestion. So none of those three categories become weak. So it's not that we have to treat Shelby for an intolerance to the enzymes, but that she should just take some with her meals to help with the digestion. Now at this point, I usually will add in the gut reflex, may I? Ready, hold, which tells me stomach acid. And that was strong. If that had gone weak, I would have had her take some betaine hydrochloride or something like that to help with the stomach acid. Okay? Now, so we have environmentals that come up. So that tells us the category. So let's go take a look at that category. Okay? I'm going to check a couple mold mixes. Ready, hold. Well, there's a weak one. Okay, that's a mold mix. Ready, hold. There's another mold mix. Ready, hold. Smut and rust from the cornfields. Now, this time of year, it's fall right now here, and they're plowing down the cornfields, and that black powder and that red rusty type powder on the corn stalks just goes everywhere. And a lot of people have intolerance to it, especially when you live around a lot of cornfields during harvesting time. So there's three actually. Now let's check this. Ready, hold. Dust, no. Ready, hold. Evergreens, no. Deciduous trees, nope. Now you got cats?
Yep.
Okay, let's check cat hair. Ready, hold. Cat hair is strong. We'll check animal epithelial and dander. Ready, hold. And that's strong. So it's not the kitties that's bothering her. Thank the Lord, huh? Okay, so. Ready, hold. And one more time. Ready, hold. Okay, so that was 2 out of the 3 mold mixes she was weak on. So we're going to have to strengthen her response to the molds. Ready, hold. Uh-oh, fabrics. Okay, so fabrics. I'm going to have to go through fabrics and see, well, what of the normal fabrics might be coming up. Hold. There's a pollen mix. Hold. Ragweed. Some more trees. And grass and weeds. So it's not that type of environmental is bothering her. Now, let's try this one. Ready, hold. Good. Dust mites. They're strong. Okay, so let's see what else here. Okay, so what we've arrived at is fabrics, smut and rust from the cornfields, and 2 mold mixes. Now, let's check out what fabrics might be coming up. Okay, so let's go through these, Shelby. Ready, hold. One more time. Ready, hold. Acrylics are okay. Acetate. I guess those are used in skirts and dresses and stuff. I don't really know. I don't wear acetate myself. Ready, hold. Cotton. I know that's a mind blower. It comes up a lot. Hold. Elastic. No. Leather's okay. Latex. Nylon. Orlon. That one was really strong, wasn't it?
Yes.
You wear Orlon?
I have no idea what that is.
Ah, okay. Polyester. Rubber. Rayon. And wool. Okay, so the only fabric that we find weakens Shelby would be cotton. And of course you have cotton on, right? Mm-hmm. Okay. Now, once we arrive at the substances we're going to try to strengthen here, put those in a baby food jar. I use the jar so that I don't have all of the patients handling and holding all of the vials. So I just use a baby food jar. And it's a real good jar to use because they don't put lead in baby food jars. Hold that. Ready, hold. Okay, that weakens her. Okay, dear, sit up. Now I'm going to strengthen Shelby by doing some acupressure along the spine. I'm going to stimulate what we call a sympathetic nerve ganglia. Take a breath. Hold your breath. Excellent. Breathe out. Hold it out. Good. Now breathe fast. Excellent. Lay down. Let's see what we get. Ready, hold. Oh, that's much better. Okay, now she was strong. Now hold, do this. Ready, hold. That's the physical level. Next one. Chemical, nutritional, and emotional. So it's not coming up on any levels. So now let's see if I introduce a certain body tissue, if it'll go weak again. So we're going to test organs. Ready, hold. No organs come up. Ready, hold. Glands. So none of the glands come up. That's awesome. Okay. So, let's see, let's check brain and central nervous system. Ready, hold. No, that's not coming up either. Now, I'm going to make 2 positive statements, or I'm just going to make some positive statements and test. The autonomic nervous system knows everything about the body. So if it's a true response, then it will stay strong. And if it's false, it'll go weak. It's called a psychological stress evaluation. It can actually be done over the phone, measuring microtremors in the voice. But it's not used for instead of polygraph, even though it's better, because people might not know that you're doing this over the phone to them. So we use the polygraph instead in the legal system. Okay, so We have to add some body fluids. Hold. No, it went weak, so that's a false statement. We have to add something from the structural system. Hold. No, that would be ligaments, tendons, joints, bones, that kind of stuff. Even skin, tissue, stuff like that. So that pretty much leaves like this one here. Ready, hold. Okay, sinus came up. So the sinus area is involved. Ready, hold. Eyes. Ready, hold. And throat. Oh, boy. Okay, now this didn't come up under, this is bronchi, and I test this now because I already checked organs, what he included the lung. Ready, hold. Bronchi is not coming up, so it's not here. All righty, it's not body fluids. Well, let's just check mucus just in case. Ready, hold. Mucus didn't come up, so when we asked for body fluids and she went weak, it meant it was a false statement, and we double checked that, and that was true. Okay, so let's see here. Well, eyes came up, so let's check tears. Ready, hold. Tears came up as well, and we just checked mucus for the sinuses and stuff, and that didn't come up. So we have arrived at some specific tissues that, when introduced separately, re-weaken her. So we are going to strengthen Shelby now. Will you sit up, please? Okay, inhale. Good. Breathe out. Hold it out. Excellent. Now breathe fast. Okay, good. Let's see what we get. Okay, let's check, see what we get if Shelby gotten strengthened. Ready, hold. And she is, okay? So, relax a minute there. Now, what just happened is this. While Shelby was holding frequencies that caused her nervous system to throw up a block to protect her, okay, I did some acupressure along the spine. And in the thoracic and the lumbar spine, there is what we call sympathetic nerve ganglia. Sympathetic nervous system is one half of the autonomic nervous system. We call it autonomic because it does things automatically, like changes the size of the pupils, perspiration, the heart rate, things like that. Now, it's split in two parts. You have the sympathetic nervous system, which is flight or fight. And then you have the balance to that, which is parasympathetic, which is the calming side. Now, we rise and fall through that all day long, okay? At least we should, instead of saying in flight and fight all the time. And a lot of people do, and that is very stressful. So, what we're going to do now is I strengthened her by stimulating the sympathetic nerve ganglia. It's a lot like this. Let's say, for instance, you have a soldier crawling around on his belly, and he's normally allergic to weeds, grass, dust, molds, dirt, okay? And he's crawling around with his face in the dirt. Well, if there's bullets zinging over his head and grenades going off, he's not sneezing, okay? He's in a flight or fight mode, so that takes precedence, which is survival. So I artificially put Shelby in that mode by stimulating the sympathetic nerve ganglia. That's why when I check right now, she's strong on what she was previously weak on. I've keyed that out for a moment. Now I'm going to make two more positive two more positive statements to see what I get to make sure we got all the tissues before we finish off the treatment with some acupuncture. Okay? We have all combinations necessary at this time. Hold. Okay, that was strong, so that was a true response. We have to add some other combinations at this time. Hold. Okay, that was a false response. So we got them all, and we don't have to add any more, so I'm done. If I didn't get both of those answers, I was going to have to go back through the systems and find out what tissue that I had missed. So that's muscle response testing, and tune in for the next video, and we're going to cover some acupuncture.